As a longtime foreign correspondent, I've worked in lots of places, but nowhere as important to the world as China. I'm Jane Perlez, former Beijing bureau chief for the New York Times. Join me on my new podcast, Face Off, US versus China, where I'll take you behind the scenes in the tumultuous US-China relationship. Find Face Off wherever you get your podcasts.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by a guest pediatrician bestie, Dr. Erin Faherty, who's a pediatric cardiologist who treats kiddos at Yale New Haven Children's Hospital. She also went to med school with my husband, Ethan, so this is a very special episode for me. All right, so today we are going to talk about myocarditis. The clock is ticking. Let's get to it. So, Erin, first things first, what is myocarditis?
So myocarditis essentially, to put it simply, is inflammation of the heart muscle. Myocarditis actually can occur both in kids and adults. And there's a severity of myocarditis, with most cases, fortunately, being mild.
So what are some of the causes of myocarditis?
So most commonly, myocarditis is caused by infection, and specifically, most often, viruses. And these viruses include common viruses, such as those that cause the common cold or upper respiratory infection. In fact, some patients may have a history of having a recent upper respiratory infection. Other less common causes include autoimmune diseases, medications, toxins. And rarely, myocarditis can be caused by immune response to a vaccine, such as the COVID-19 vaccine or smallpox vaccine. And sometimes with myocarditis, there's actually no identifiable cause.
So how would a viral infection cause myocarditis?
So in the case of a viral trigger of myocarditis, the virus itself actually infects the heart muscle. And then the virus grows and reproduces in the heart. But the inflammatory process occurs when the immune system responds appropriately and sends immune cells to go fight the virus. Sometimes the immune response itself is overly aggressive in some children and can damage the heart muscle. We don't yet well understand why some kids, the immune response is overly aggressive. So often, the inflammation and the damage of the heart muscle in myocarditis is from both the virus and the body's immune response as well.
What are the symptoms of children with myocarditis?
Because there is a range of the severity of myocarditis, there also can be a range of the symptoms. In fact, sometimes the symptoms can be quite subtle. For mild cases, children may present with chest pain, palpitations, fatigue, fever, or shortness of breath. In more severe cases, the inflammation of the heart muscle and therefore the damage of the heart muscle can cause the heart muscle to be weak, and that leads to heart failure. And so in cases of heart failure, children may present with swelling, exercise intolerance, significant fatigue, and sometimes even nausea and vomiting.
So how does a pediatric cardiologist actually diagnose and treat myocarditis?
So there's actually not one specific test for myocarditis. Often when there's a concern for myocarditis based on a patient's symptoms or exam, a pediatric cardiologist will be consulted. A pediatric cardiologist will then further evaluate for myocarditis with blood tests, sometimes specifically called the troponin test, which leaks into the blood when there's heart damage. Also, we'll use an EKG, an echocardiogram, as part of our evaluation. Fortunately, most often, the inflammation in myocarditis is mild and can be treated with anti-inflammatory medications, such as even ibuprofen. Often, children with a diagnosis or concern for myocarditis will actually be admitted to the hospital so we can observe them really closely. For more severe cases of myocarditis, these patients sometimes may need medicines to help their heart pump more effectively, or medications to control potential rhythm disturbances, or sometimes even medications to help support their blood pressure. But for any cases of myocarditis, it is really important to avoid strenuous activity during the recovery period, as there's evidence that suggests exercise may be more harmful to the healing heart. After a diagnosis of myocarditis, a child or adolescent will follow closely with the pediatric cardiologist and to determine when it is safe for him or her to return to exercise.
So, Erin, last question. I'm sure there are some folks listening who may have been hesitant to get their child the COVID-19 vaccine because of concerns over myocarditis. So what would you say to those parents?
So overall, there's a very minor risk of myocarditis after the COVID-19 vaccine. Overall, cases are very rare. Cases of myocarditis and pericarditis have been more common in adolescents and young adults after receiving the COVID-19 vaccine. And fortunately, most cases of heart inflammation following the COVID-19 vaccine are mild and respond well to medication and rest. We do know that the COVID-19 virus itself can cause significant short-term and long-term damage to the heart and the cardiovascular system. And so from the data we have, the risk of COVID-19 infection far outweigh the minor risk of vaccination.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. Special thanks to Dr. Erin Faherty, pediatric cardiologist, for her time and expertise. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.